morning, everyone. The subject we're going to look at this morning is hydrotherapy. Hydrotherapy is water therapy. And before I begin demonstrating some basic hydrotherapy procedures that you can do in your own home, and all you need, as you can see, is lots of towels and blankets. Hold on to your woolen blankets. They're becoming as rare as hen's teeth. But it's actually wool and wool only that will hold the heat in when you're doing your hydrotherapy treatments. We found it very difficult to get woolen blankets, and we had a lady attend a massage course that we did about 18 months ago. And she said, I work in a second-hand shop. The lady was in her late 60s. She said, is there anything you'd like me to keep my eye out for? I said, yes, woolen blankets. Well, the next time Michael went down to her town, he came back with 20 woolen blankets. We have a lot of woolen blankets, so if ever you see them in the second-hand shop, grab them, because they hold that heat in. It's like when it rains, the rain stays on the wool's back, doesn't the sheep's back, sorry, on the top of the wool. It's excellent for keeping that warmth in. Whereas if I used a cotton sheet for this instead of a woolen blanket, of course the water would go straight through and the person would chill. And even if I were to use a blanket like here, this one under here, it's like an acrylic thing, that still would get wet and the air would chill it. But it makes a nice little base for underneath. But it is wool and wool only that can be used for these treatments. So before we begin demonstrating, I'd like to go through some basic guidelines onto why hot and cold treatments do what they do. I've touched on it last night and I touched on it a little bit yesterday, but I want to show you basically what cold does. So first of all, we'll look at hot though. And hot, initially, so the initial effect of hot water on the body, and basically I'm talking about water. I'm not talking about cool air or hot air, I'm talking about water. And with water, water can be used in three forms. It can be used as a gas, and the gas is steam. It can be used solid, and the solid, of course, is ice. And it can be used as a liquid, and the liquid, of course, is the water. So they're the three forms of water that we use in hydrotherapy treatments. But first of all, we'll have a look at the effect of hot. The initial effect of hot is stimulation. And in this weather, we all know it. We're cold and we have a hot shower, or we're cold and we have a hot bath. When you get into that hot water, there's a stimulating effect, isn't it? Tingling. But if we stay in that hot bath, it is not long before everything slows down. We call it depression. So the lasting effect, or the prolonged effect, is depression, or a total slowing down. Now, the difference between hot and cold is the time it takes to get from the stimulating effect to the depressing effect. And the time is 3 minutes. So let's have a look at cold. When you apply cold water, the initial effect is stimulation. Now, one of my patients that I'm going to use, I call a patient or subject, I've prepared him that I'm going to be applying cold. And he's going to go like this. And we've done a lot of discussion on that, and he assures me that he doesn't mind a bit of cold. We don't like cold because we're warm-blooded creatures. So the initial effect of cold is stimulation. That's why we go, that's why it's, that will really wake you up, won't it? But the lasting effect of cold is also depression. And that's where people can die of hypothermia. being in cold for a long, long time, everything just slows down and all body systems stop. But the difference is, with cold, it only takes 30 seconds. It only takes 30 seconds to get from stimulation to depression. So when we do the hot and cold treatments, and last night I explained the little boy with the swollen finger, and we had two cups, and it was hot for 3 minutes, cold for 30 seconds, and we did that 3 times. Now the reason you only do it 3 times is because it has a dramatic effect to move blood in a mighty way. And what happens is the body gets exhausted after three times. So you're better to do 3 times every 2 hours rather than 6 times every 6 hours. Can you see that? Why would you do it every 2 hours? Well, if someone's in pain and it's bringing them a lot of relief, that's what you would do. That's in a crisis, you might do it. You might do it like that. And so, as we've already discussed in our previous lectures, you can do hands, you can do elbows, you can do feet, you can sit in it. And traditionally, those are called sitz baths. It's German for sit. And why would you use sitz baths? Sitz baths have a powerful effect on things like constipation, on things like irritable bowel, on things like kidney problems, on things like hemorrhoids, on things like incontinence, urinary incontinence, prolapse, kidney stones. So urinary and also reproductive and also colon, you would do sitz baths. Now what you need is 3 big tubs. We're not going to demonstrate that one. Where you sit in very hot, and then you sit in cold, and you sit in very hot. And I'll tell you the story of a young man that did our program. This young man was only 14, and he had a problem. His anal sphincter wasn't working well, and if he had diarrhea, he would have an accident in the classroom. Can you imagine how embarrassing that was for this young man? If he had constipation, he didn't have accidents. He'd already had 1 operation. Now you want to be very, very cautious about having an operation in that area. It really hadn't helped. His auntie rang me and I said, "Can you come to our retreat? I think we can help." And it was down in Melbourne, and we had some sitz baths in our hydrotherapy department. So what I did was I got the male therapist to give him sitz baths every morning and every afternoon. Every morning he would sit in hot water, then he'd get up and sit in cold water, then sit in hot, basically with these times, 3 times. It also showed me this young man had another problem, because we shouldn't be alternating between diarrhea and constipation. So we also worked on the gut to heal the gut. By the end of the week, he was a very happy young man because he started to get feeling in his anal sphincter. He also was not having diarrhea or constipation anymore because we'd done some dietary changes. We're giving him herbs. Now, can you imagine what the hot and colds is doing to that anal sphincter? It's waking it up, and it's increasing the blood supply to there, and the bloods feed the nerves. Do you know that young man did not have 1 more accident, ever again? Now, I said to him, if ever things start to go a little bit, what my husband calls belly up, I don't know if it's an Aussie saying, what does he do? He goes back onto the sitz baths. Now, what you can do, you can look around for big tubs, and I guess for people that are carrying a little bit of extra weight, they have to do some high-intensity exercise program and stop the weight and start drinking more water, etc., and get the weight down. It's a lot easier when someone is light to sit in hot and cold and get tubs that size. But Dr. Agatha Thrash, she's an American doctor, she has passed now. She has written books on hydrotherapy, and so has Dr. Kellogg, many books, encyclopedias on hydrotherapy. And both of them maintain that 30 in a row is very powerful. That's every night for 30 nights to do the sitz baths. For constipation, for incontinence, for irritable bowel, for fibroids in the uterus, for all of these areas. What you're doing is you're increasing the blood to the area. When you increase blood to the area, what are you increasing? I hope you can see this. What does blood contain? Yes, blood contains white blood cells, and as I showed you last night, that's your internal army. And what blood also contains is red blood cells. And red blood cells have a few functions. Red blood cells carry your nutrition. Red blood cells carry your oxygen. Red blood cells carry your water. And red blood cells take away waste. So as I showed you last night, those were there last night, we looked at the immune system. All you need is more blood. All you need is more blood to an injury. And when you get more blood into the injury, can you see you've got everything that injury needs to heal. And this is why the water treatments are so powerful. Now, some treatments you would just use ice. And on the side of the football field, there's no buckets of hot water, is there? What are there buckets of? Ice. Because ice is one of the most powerful anti-inflammatory agents. It will cool the area, and one of the first hydrotherapy treatments that was ever done was just water. You put a face cloth in or a towel, and you wring it out, and you lay it over the hot inflamed area. And as soon as it gets hot, you see what water does is it holds hot or cold better than anything. It's going to draw all the heat out, and then you put another one on, and then you put another one on. And you don't even need a fridge to have ice. All you need is water and a cloth. And you will find within 15 minutes that hot inflamed area is no more hot. It's all the heat. Where'd the heat go? It went into the washer. You could feel it. The washer's now hot. So that's one of the easiest things that you can do. And even if you're on a mountaintop or camping, you've always got water and you've always got a cloth, haven't you? The first treatment that I'm going to demonstrate to you is a wet sheet pack. Now, a wet sheet pack, I'm going to put this sheet and I'm going to put it into water, and in Invercargill you don't have to put ice in the water, do you? No. And I'm going to wet it, and I'm going to lay the I'm going to wring it out and lay it over this blanket here. And the young man who has agreed to do this and demonstrate it for me, I'm going to wrap his body in this wet sheet, and then I'm going to quickly put the blanket over. So the discomfort he will experience will be momentarily. Why would I do such a thing? I would do it for 3 reasons. One is if my young man Jeremy had a fever. Now what you've got to remember is your fever is your friend. What's your fever, students? Your friend. Do you know what that high heat does? It burns out the microbes. It burns out the pathogens. It's fantastic. Whenever you get a fever, rejoice. And what you've got to remember is fever is your friend, and water will put the fire out. So the only time you'll have trouble in a fever is if you're dehydrated. So you must be drinking a lot of water. And the other thing to remember is that when all the rubbish is burnt up, the fire will go out. Did you hear that? If your body has created a fever, it's created it for a reason. And it needs you to help it. So let's say my young friend here has a fever. He's got a chest cold and he's got a fever. Rejoice! Because the pathogens that might be getting out of control, what's the heat going to do to them? Kill them! But Jeremy's terribly uncomfortable with this fever. It's getting quite high. I never used a thermometer. All you have to do is put your fingers on their neck. Ooh. Do you need a thermometer? One lady said, her little boy did our program. She said, have you got a thermometer? I said, no, we don't use them. He said, but he's got a fever. I said, that's perfectly fine. But what will I do? I said, give him lots of water. All he wants to do is sleep. Is that good? It's fantastic. You see, your body knows what to do. She said he doesn't want to eat. I said, fantastic. Because he doesn't want to eat. You don't want any energy going there. You want energy going to healing. But why has he got the fever? I said, I don't know, but the body knows. Can you see that? The only time you step in is when the child's looking a little uncomfortable. Then you might do something to just bring it down a little bit, yeah? And that's what the wet sheet pack can do. Now, there are a few things you can do to bring the fever down. Put the child or the human being in a tepid bath, not hot, not cold. Will they like cold if they're on fire? No, it's too cold. Can you see that? Just put them in a tepid bath. It will be a little cool to them. And you know what that tepid bath will do? It'll draw the heat out of their body. See, when a person has a fever and it's getting very high and they're uncomfortable, the body needs help. It needs help to draw the heat out. And so just in a tepid bath can help. But when you've got a little one who's 2, he doesn't want to go in the bath. He wants you to cuddle him. And this is where the wet sheet pack can help. So Jeremy, would you like to come up now? I said to Jeremy that my boy Peter, you can take your shoes and socks off. He's got his swimming clothes on. And I can assure you that if we were near a pool, because I know my grandchildren, no matter what the weather they're in, is that right? They love it. Now you could make this warm, but by the time you've undone it, now, before you jump on, I'll just talk a little bit more. I'll just reduce the agony for him. So what you do is you have it so that you've got a little bit over both sides. And what I'm going to get Jeremy to do is put his hands up in the air, and the first wrap will go under his arms and between his legs. Then he's going to put his arms down, and then the second wrap will go over the whole body. And this will be uncomfortable for Jeremy because it's cold, but he told me he loves cold. And then I'm going to put the woolen blanket on, and very, very quickly the discomfort will go. You ready? Good. Jump on, Jeremy. On your back. That's good, that's good. Arms up in the air. That's good. Between the legs. It's a bit cold. Arms down, down. So that's a little bit cold and uncomfortable, but he's still smiling. Wow, this is amazing. Amazing. Okay, how's that? Better. Now just show that we make sure he really warms up. I've got another blanket, but if he's got a fever, we don't want to put too much blankets on him. But he hasn't got a fever actually. And this one is like a microfiber one, and a lot of people don't like, just put your chin up. Good, good. A lot of people don't like the wool next to their skin, so that can help with that. So we want to make sure that no air is getting into the cold. It'll keep it cold. Are you warming up? He's warming up. Now, Jeremy is 7, and Jeremy and I ran up hills this morning, and I know he's got a lot of energy, so his little body can warm this up quickly. Now, if you've got someone who hasn't quite got the energy of Jeremy, what you can do is you can put a hot water bottle next to their feet, so under here, and that will warm them up very quickly. Now, yes?
Quick question to ask. It looks like it might be a good idea if you're on your own and you're really, really sick.
If you're on your own, you don't do this, okay?
Oh, okay.
You have to have, if you're on your own, you have a tepid bath. You just have a tepid bath. You're warming up? So what I'm going to do now, I'm going to put my arm down and check that he's warming up. Well, we're starting to warm up, but I think I'd like another blanket on there.
Would you do this clothed how he is now?
No. Ideally, you do it as least clothes as possible. I was being kind to let him have his little rashy shirt on. But ideally, just a little pair of underpants because of modesty. We just had board shorts on, so that would be the best. Actually, the best is naked, if you can do it naked, but or as little as possible. Now notice what I did. Every surface area of the body is covered with the wet sheet. Now the 3 areas where you would do this for a fever. And what will happen is, if Jeremy had a fever, within 5-10 minutes, that sheet is hot. And what you can do is you can take him out and give him a tepid shower and dress him, and usually the fever has come down so that it is now comfortable. Now you can do this. Now let's say the fever comes back up again in 2 hours, you do it again. You do it again, because the reason why Jeremy's fever would have come down is all the heat that was in his body has gone into the wet sheet. In fact, the sheet gets very, very hot. And that's the water is being drawn out of his body. Now let's say Jeremy's got a bad cough and we're doing onion syrup and we're doing onion on the feet, but we really want to boost it along. We can create a fever. So you can do this to create a fever. And if I wanted to create a fever, I would certainly put a hot water bottle on the bottom of the feet, and I would put a big feather blanket on as well. If I put 10 more woolen blankets on, that might squash poor Jeremy, because they can be quite heavy. And I create a fever. And then I would feel, oh, he's very nice and warm, but he's not too warm. So you can create a fever. And if you're getting a cold and you want to knock that cold because you've got to go to work or you've got to go travelling or a wedding and you really want to knock the cold quickly, have a flu bomb, have a wet sheet back and pile the blankets on and create a fever. Create a fever that will burn it out. Now another reason, so you can do it to reduce a fever and you can do it to create a fever. So that's 2 reasons that I've looked at. Now, my daughter told me that her little one had a fever and he's crying, wanting mother, so she couldn't put him in the tepid bath. He's only about 12 months old. So she just took his clothes off, wrapped him in a wet sheet. Oh, did he scream? Wrapped him in a woolen blanket and held him tight, and the screaming stopped. And now she can cuddle him and keep him close, and he's in a wet sheet pack. So the little ones, as I said, Jeremy's discomfort was momentarily. It's just very brief. That's why since early this morning I've been preparing Jeremy for the discomfort of that cold. Are you hot, warm or cool?
Cool.
He's cool. So he's starting to warm up. If we want him to warm up more, we put another blanket on. Now if you do this on someone that's got a lot more padding on them than Jeremy, they of course warm up a lot quicker. So can you see you're watching your patient here? Yes, I can feel the wet sheet up near his shoulders and it's certainly warming up. Because he hasn't got a fever, it hasn't warmed up really quickly, but it's warming up. So we're just going to let Jeremy lie here until he gets nice and warm, okay? So when you get nice and warm, are you comfortable? He said this morning he might fall asleep. Do you know that's the other thing that can happen? If someone's very, very stressed, you can wrap them up in a wet sheet pack, put lots of blankets on them, and they usually fall asleep. Because all that moist heat relaxes the muscles and the person falls asleep. In fact, I was doing it one day and the lady fell asleep and I said to my helper, we'll just leave them there. 2 hours later, they're still in the wet sheet pack because the moist heat was just relaxing them. So that's a wet sheet pack, and they're the 3 reasons that you would use them. Are there any questions around the wet sheet pack? Yes?
We will always start with the same, but
Not to cover the heart. Okay, not to cover the heart. I don't understand that reasoning, because if someone has a racing heart, high blood pressure, ice on the heart slows and strengthens the heartbeat. Yeah, so that's another reason that you can use the cold on the heart. And we have a steam sauna at our health retreat, and it's a little hut built down by the creek, and we have a wood-fired steam sauna, and it pumps it into the little hut, which is lined with wood. And our guests go in the hot sauna, and then they dive in the mountain creek, and then back in the hot sauna. So this is hot and cold done to the whole body. And I've had a few people over the years say to me, my doctor says I must not do the steam because I have high blood pressure and it will make me worse. And I said, all right, I understand his concern, but I said, if you would like to try the sauna, and there's a staff member with you the whole time, we will put an ice pack on your heart, and that will strengthen and slow the heart rate, so you will not have a trouble. And they do, and they have no trouble. In fact, one lady, I went down there and she was running out of the cold and into the hot with her lump of ice on her chair. She said, oh, I'm so glad I didn't listen to the doctor. And I understand his concerns, but we have had no problems with people like that.
They did a study in Sweden that most people have a sauna in the weekend, and also most heart attacks occur.
Okay, the study in Sweden showed people have saunas on the weekend and have heart attacks on the Sunday. Well, as you'll find out tonight, heart attacks are not caused by cholesterol. Heart attacks are caused by damage to the arterial wall. So for someone to have a heart attack after having a sauna, they're nearly there. And all that's done is tip the scales. Because if a heart attack happens, it's because the blood's not getting through the arteries. So then you would have a look at why the blood's not getting through the arteries. But we do saunas every program. We have been doing it for 20 years and no one's had a heart attack. So there must be more in the equation. But if you look into, you've heard of Dr. Kellogg? He wrote encyclopedias on hydrotherapy or water therapy. And the ice slows and strengthens the heartbeat. In fact, you know what the athletes do? And this helps them to prepare for their event. They lie in baths of ice cold water, or that would be very, very hard. They lie in there for about 15 minutes because the cold has an incredible tonic effect for the body. I think I'd be nearly dead if I lied in a cold bath for 15 minutes. You've heard of the icebreakers? They're these guys in their 80s and 90s that dive in the sea in Melbourne every morning. And they'd actually live a lot longer if they'd stopped their alcohol and their cigarettes and and did a healthier diet. But it is not unusual in the European countries to have steam saunas and then run out in the snow and rub the snow all and then go back into the ice. So that's not as hard as this, is it? Are you warming up? He's warming up. He's warming up. So that's the wet sheet pack. What I'd like to do now, and I'm wondering if Joshua could come up for this. I'd like to demonstrate to you, and when you come up, thank you, Joshua, we'll move this table. You're still important, we're just going to move you aside, okay? So we're just going to move this table over here a bit. Oh! Right. Thank you, Joshua. If you just help me a little here. I'm going to demonstrate to you with Joshua how you can do the hot and cold treatments. So if you could put a cup of cold water in there. Or a bucket, yeah, just one. That's all. Now we're just going to pretend that Joshua has an ingrown toenail. If you could take your shoes and socks off. So you need a bucket of hot and a bucket of cold. And what you also need is another kettle beside, which we'll get ready here. So this is the hot. If you could put it in the hot, is that okay?
Yeah.
Okay, both in there. Now this is very simple. This is hot for 3 minutes. So we're looking at the clock. So at almost 1:15, Joshua put his feet back in the cold. Now there's a few reasons why we would do this. One would be that Joshua had a bad headache. One would be that he had a bad chest cold. One would be maybe he's got cramping in his abdomen. Or we would do it for a sprained ankle. Or we would do it for an ingrown toenail. I had plantar fasciitis for a while. That's the inflammation of the plantar fascia tendon at the bottom of the foot. And the doctor said to me, it will be 10 months before you recover from this. And I thought, I'm going to speed this up. You know, it takes longer for tendons and ligaments to heal than bones. So I did this every morning. I did 3 minutes hot, 30 seconds cold, 3 times. Every morning and every afternoon. And I would lecture every morning for 2 hours, and by the end of the lecture my foot was aching. I'd go home and I'd do hot and colds, and at the end of the hot and colds I had no pain at all. I conquered it in 6 months instead of 10 months. And it's quite painful. It's painful to walk. How did I do it? Maybe I was running up a hill and trod on a rock, or I don't know, but it happened. Now, many people have contacted me with plantar fasciitis, and I tell them what to do, and guess what? They don't do it. One man said, but the doctor says if I have this operation and I take this drug. He got back to me 2 months later, it didn't work. And now you've got the side effect of the drug. So what was my answer? Go back to the hot. It's too simple and it's time consuming. How long does it take, students? What's the maths on that? 15 minutes. Have you got 15 minutes? Everyone's got 15 minutes. Look at how much time people spend watching television. How many people spend time on the... And actually, if you want to watch television, as you'll see on Saturday morning, you've got to be very careful what you watch, because some of the bad messages going into the brain changes the way we think. Maybe you watch a nice documentary, or Jeremy was telling me how he was watching about how the ear works and the eye works. That's good stuff to watch. We'll do your hot and colds then. I think we're nearly to 3 minutes, so I'm just going to get some ice. Handful of ice. The hotter the hot, the colder the cold, the better the reaction. A bit more, I think. Okay, I think we're nearly, yep. Now what I don't usually have to ask the person to put it back in the hot. You can count to 30 if you like. But what I'd prefer to do is wait until I can put more hot in that. My kettle's nearly boiled. Now while the person's got their feet in the cold water, you top up the hot. And you'll find that after the cold, they can handle the hot a little bit better. And because Joshua has had his feet in the hot water, the cold's almost a relief. Is that right?
Yeah.
He's still smiling. Jeremy's still awake. That's hot enough. So always test it with your hand. Okay. You can go back. How's that? Nice. The hotter the hot and the colder the cold, the more powerful the reaction. And because the cold is brief, it does not hurt. Because the cold is brief, it is not uncomfortable. And I had one lady that had 25% kidney function do our program, and we were doing sitz baths on her. And because I was cautious not to have those kidneys chill, so I said to the staff, I want you to do 3 minutes hot and 10 seconds cold. Anyway, they said to me, Barbara, she's complaining. She wants more in the cold. I said, okay, because you know what I'm listening to? I'm listening to the body. So she did 30 seconds cold and she did 3 minutes hot, and her body said yes. So again, you're watching the person. Now with Jeremy, he wasn't heating up fast enough for me, so I put another blanket on, and he still wasn't heating up fast enough, so I put another blanket on. And if I put any more on, I might crush him because he's only a little bloke and the blankets are heavy. But see how you're watching the person. But if Jeremy had a fever, I would not have to put that many blankets on because the heat in his body is heating it up. I'm not watching the clock. Sometimes I don't watch the clock, I just guess. But it's about 3 minutes. When I was doing the hot and colds on my feet, I just used to guess. And you certainly can guess. That's why I would prefer to read the body. I'd prefer to read the body than read test results. Because you know what? Test results change. They can change from day to day. It's like the lady that was taking her blood pressure every 3 hours. I said, stop taking your blood pressure. Don't do that anymore. Most people with high blood pressure, they can tell. They can tell. So it's time to go back to reading your body's signs and symptoms. It's not that I say never take a temperature, but I never do. When I was a student nurse, I used to have to take 20 temperatures and 20 blood pressures and 20 pulses every 4 hours. Because it changes. If I've just run up a hill, my pulse is going to be big. If I'm upset, it's going to be big. If I've just eaten a meal, you see, everything can affect all of those. That's why I say, how does your body feel? And often, when you're ready for cold, you ready for cold?
Yeah.
Yes. Oh, did you hear that? Yes, you can go back in. Is the cold uncomfortable?
Not really.
No, see, it's not really. It is actually good for you to test it on yourself. Just do it with 2 little cups. And by the time you're finished, you'll have a glowing red finger because of the influx of blood into the area. So let's go back to our wet sheet pack man, who looks quite comfortable there. And I'm going to put my hand down there. Oh, he's warm. He's very warm. Remember that cold sheet? That cold sheet is now nice and warm. So when Joshua finishes the hot and colds, we'll take Jeremy out of his wet sheet pack. Basically, how long do you leave him in there? Well, if he's got a high fever and the sheet's getting very hot, you would take it out. If the sheet gets very hot and the patient falls asleep, guess what you do? You just leave them there. You just leave them there. So you're feeling the way, yeah?
I'm just going to ask, we talked about one that's going to increase the blood flow to the actual area. If you're actually doing a foot bath for a headache, how does that actually work?
It's a very good question. How does it work in a headache? In a headache, the blood tends to get congested in the head. So when you put your feet in hot water, the congestion blood gets drawn down to the feet. There's a couple of things you can do. You can alternate it like this, or you can do a straight hot foot bath where it's just hot for about 20 minutes. So you can do that too. And you wouldn't do that for an infected toe, you wouldn't do that for plantar fasciitis, you wouldn't do it for a sprained ankle, you would do it basically just for a headache. Yes?
Would the headache thing, would that only be for vascular headache? Because there are other types too, aren't there?
Do you know, if it relieves it, do it. So, yeah, it's whatever works. There's the only time you would never do this is on a diabetic. A diabetic cannot feel the extremities. And if you do that on a diabetic, you could damage the tissues. You also would not do it on a very elderly person that has poor circulation. Anyone who has poor circulation in their feet. Some people think, oh, the feet are cold, let's warm them up with hot water. No, no, no. No, no. It's like if someone has frostbite, you never put their feet in hot water. You put their feet in cool water. And then as the body warms up, you can put a little bit more in. And yesterday we looked at a cane pepper poultice, or compress on the bottom of the feet. That's what you do to a diabetic. That's what you do to people that have no feeling in their feet. And that's what you do for peripheral neuropathy. So there's caution for people who don't have feeling in their feet. Now, because Joshua is young and strong, I knew that temperature would be fine. But for some people who you're not sure of, I put their foot in my hand and I lower my hand in with their foot and I'm watching their face. And you will know straight away if that's too hot. That's too hot. If it's too hot, put a bit of ice in. And some might say, but it's not hot enough. That's all right. Because after their feet have been in cold water, they can handle that a lot hotter. That second hot that I did for Joshua was very hot, wasn't it? It was hotter than the first? Yeah. Yeah, see, a lot hotter, because I knew that he could take it. Now this is the last one, so we'll heat it up a bit more. This last one, they usually can handle it a lot hotter. Okay. So there I've just explained two different types of hot foot baths. The straight hot foot bath for a headache. For a migraine, make it really hot, and keep that going for almost 40 minutes. And no. Oh, you could try. You can't really work with them. And when you do the straight hot foot bath, 20 minutes for a headache, maybe 40 minutes very hot for a migraine, you always finish with cold. And because when we do straight hot foot bath, you don't actually have a cold bucket there, I get them to put their feet up and you just pour cold water over it and then just dry their feet. Because remember what cold does? We talked about that last night. Cold equalizes the circulation and prevents chilling. Now, I wouldn't be surprised, Joshua, is this warming you up a bit? Yeah. See, even though he's got the quick cold, he's warming up. And oh dear, there's no ice. I'll get more. We want this last one to be good. Now that's cold when I carry it, but it's brief. And notice me carrying the cold, my hands are quite red because the quick cold brings the blood to the area. So as you can see, it's actually brief. It doesn't take long. When I had my plantar fasciitis, because I travel quite a bit giving meetings, I always had 2 buckets in the car, because when you stay in a hotel or a motel, there's always a little freezer, and I'd check straight away. If there's no ice in there, I'd make ice, and there's always a kettle, because everyone wants their cups of coffees and teas. So it was actually a very easy thing to do. It's a very powerful treatment, and all it takes is time. And I guess that's what a lot of people believe they don't have enough of. But you know, the king on his throne and the pauper on the streets in the slums, they've got the same amount of time, is that right? So really it's time management. And that's where these 8 laws of health help you to have time management. Because when you eat breakfast like a king and lunch like a queen and tea like a pauper and go to bed early and get up early, you've got so much more time in your day. I actually went out to do my morning walk this morning and I thought, oh no, it's pitch black, I better go back and do a few more things, and then tried later, which I did. So we walked about, I don't know, 6:45, I think. Is that right? And as we were walking, the most magnificent sunrise. Did anyone see the sunrise this morning? Those who were out doing their running up and down hills? Just brilliant. Did you know that when our eyes experience that first hour of light in the day, it resets the circadian rhythm in the brain? And Dr. Neil Nedley, who wrote the book Depression: A Way Out, he found that people with depression, 80% of them, their circadian rhythm is out. So there's many reasons why it's the best time to exercise. And by the time we came back, we were very hot. I think that's about 3 minutes. Do you think so? Yeah. Okay, back into the cold. How's that? That's equalising the circulation, prevent chilling, closing the pores. So again, when people have poor circulation, you would think this would help them, but you have to basically return their circulation with the cane pepper compresses. And when they have that. If someone doesn't have good circulation, you could do warm and cool. And as their circulation increases, maybe you can build up to the hot and cold. But I know that Joshua's circulation is fantastic. Look how he's dressed. Look how I'm dressed. Okay, so we'll do 1 foot at a time. First foot out. Okay, and the next foot out. Okay, thank you. Thank you, Joshua. Now, I think we'll have a break because the next procedure that I want to demonstrate to you is probably the most powerful, which is hot and cold compresses on the chest, because you can't put a chest in hot and colds. And so it's almost 25 past, so what I think I'll do, we'll get Jeremy out. And before we get him out, if you like, you can come and put your hand down and feel the heat of him, or maybe you'll just believe me. But he's quite warm. And yet that sheet, was that sheet cold? Mm-hmm. It was very cold. So maybe it'll be a bit disruptive for everyone to come up. Just, I'm sure you believe me. I'll just get a towel.
Just ask, you mentioned that the cold equalises.
The cold equalises the circulation. That's the beauty of the cold. Now, when you're getting your patient out, it's important that you, don't let them chill, because he is very, very warm right now. So I've got a nice big towel here to wrap him in. And what do you do now? Well, what Jeremy can do now is he can go and have a tepid shower. That's not hot, not cold, and put warm clothes on. See, this is very warm. I can feel the warmth through here. And I want to be careful not to chill him, so I'm going to take him off bit by bit. You probably don't want to move, eh? You're probably quite happy there. Oh yes, this sheet is quite warm. So little by little I'm going to take that off so that, you see, if I just bared him, of course the cool air will touch that sheet and possibly chill him. So we're going to, okay, feet up. That's good. Okay, jump up quick. That's good. Over here. That's good. Oh. Thank you, Jeremy. You can go and get dressed now. So, yeah, that sheet's quite warm. And if he'd had a fever, that sheet would be, it's cold now. If he had a fever, that sheet would be very, very hot. So it's the most powerful way to get a fever down. And as you can see, it's a lot of work, and as Les Lady said, you cannot do it to yourself. So if someone has a fever, sometimes the best thing is just to have a tepid bath, not hot, not cold. Drink a lot of water, keep that cool on their head. And one very simple thing that will often get a fever down is just a hot foot bath. Just having a hot foot bath, you'll find that most people that have a fever, you feel their feet will be cold. So heating their feet up can actually pull the heat down to there. So there's lots of little things you can do when someone has a fever. There's a little bit of time, so I'm not going to demonstrate. I'm just going to give an illustration here. Now let's say I've got someone lying here, a little child that has a fever, and they've just got a pair of pants on and I've got them covered. What I can do is I can take one leg out, get a cloth, and just put the damp cloth over them, and by the time I've done that, that'll be hot. I dry it and then I cover it. And then I do the other leg, and I just get the cloth that's wet and just sponge it, and that'll take the heat off, then cover that. And then the arm. and then another arm, and then the body, and then turn them over and do the back. And by the time I've done the whole body, the fever will have dropped down. So that's another procedure, because some children are a little delicate and it's not easy to wrap them in a wet sheet. And I don't believe in fighting and physically, forcing children. For a little tiny one, they don't know, so you just wrap them up. And that's why I worked with Jeremy. I explained exactly what I was going to do, and if he said, nah, you know what I would say? Okay. And maybe Joshua would have agreed. My two youngest boys, there's no way I could have done that to William. He was my delicate one. But Peter, I could do anything to Peter. I could wrap him in wet sheets, I could do anything. So you see, you're also working with the nature of the person. One lady said to me that she used to get her husband to hold her 10-year-old daughter down and force olive leaf extract down her mouth. I said, don't ever do that. She said, but she's got a urinary tract infection. And I said, no, you have to win her first, because all that will do is make the child angry. And the Bible says don't stir up anger in your children. To children it has to be fair. If children have done wrong and they get punished, they accept it because they know they've done wrong. She said, well, what will I do? I said, you say to your child, I'm so sorry you've got a urinary tract infection, because that's what she had. I said, I can give you this bit of medicine, but it won't taste nice. And the child goes, no. And you go, what if I take it too? No. What if I sing opera and tap dance all around the room when we take it? Sometimes that works. No. What if I give you a strawberry just after you've taken it? No. And you know what the parent says then? Okay. 2 hours later, the child is crying. She's just urinated and it's stung. The parent comes, puts their arm around her and says, you poor darling. Never say, well, I told you so. You know what that's done now? It's built a brick wall between you and your child, and there's no way that child will take your medicine. You poor sweetheart. Oh, that must hurt. It does. When she settles down, do you want to try the medicine? Most children at that point will. Can you see what you work with? You work with the will. And when you're doing natural treatments, you never do it to someone that doesn't want it. You always work with the person, explain what's going to happen. So I wrapped up Jeremy this morning with the dry cloth so he knew exactly what we were going to do, because I feared that as soon as he touched that wet sheet pack, he'd run out the door. See, working with the will. You're working with the will. With children, with people when you're doing treatments with them. Explain it. There's a Proverbs 14 verse 6 that says, knowledge is easy to him that understands. So you explain it. And when you get the nod, you know you can do it.